Okay, so UKALL14 is the current UK trial for adults with acute lymphoblastic leukemia who are aged between 25 and 65. So my interest in this study is this is the first study in the UK where we've used genetics to risk stratify patients. So patients with one of 4 genetic abnormalities that we identified in our previous trial are now classified as high risk and treated differently. And what happens is patients after their induction phase get stratified as either standard risk or high risk and then treated accordingly. So what we've done in this particular study of the genetics of UKALL14 is look at all the patients that have B-cell precursor ALL, which is the majority, about 85% of patients. And we have screened prospectively for all the high-risk abnormalities and shown that even in this trial, when they're treated as high risk, their outcome is significantly worse than patients with standard risk genetics. But in addition to that, what we've also done is we've screened over 600 patients for novel abnormalities that we didn't know about at the beginning of the trial. Many of these are ABL-class abnormalities, which are well known in the field now, and also JAK-STAT abnormalities, and also rearrangements involving a gene called ZNF384. And the key message that we found from this trial is the incidence of ABL-class fusions, which are theoretically targetable by a drug called Imatinib, are much lower than we had previously estimated. So that means that the ability to use that drug, Imatinib or dasatinib, more widely in adult ALL might be less than we previously thought. In addition, we found that patients that had a JAK-STAT abnormality had a very high risk of relapse and also death. And this was predominantly because their MRD at the end of phase 2 was much, much higher than we would expect for other patients with acute lymphoblastic leukemia. And the third interesting but very preliminary result is that patients that had a rearrangement of the gene ZNF384 seemed to have an excellent outcome on UKALL14. Now, admittedly, this patient subgroup was quite small, but within the context of adult ALL, it is potentially the first really good genetic risk factor that we've identified. Obviously, this will need greater follow-up and validation in larger cohorts.